My name is Sia Henry, and I am the Associate Director of Policy and Advocacy at the Multidisciplinary Association for Psychedelic Studies. So, MAPS a couple of years ago started talking about creating a project to look at the needs of system impacted people and the ability of psychedelics to help address those needs. So, we've decided to call that project the Psychedelics for System Impacted People Project. And we started that project by creating a literature review. So the purpose of that literature review is to explore the mental health needs of system impacted people, starting with childhood. So, for instance, looking at adverse childhood experiences of people who are most likely to then later on in life end up having some type of contact with the criminal legal system. Also looking at pre-existing mental health issues prior to incarceration, and then also exploring the impact of trauma, violence, and neglect that happens during incarceration. And then, ending with reentry needs and the lack of mental health services as people are leaving periods of incarceration and reentering society. So we recently published that literature review that you can download from MAPS's website. And I like to look at that literature review as kind of, giving the field our why. So kind of giving people a sense of why we're even talking about this population. So to date, from what I've seen, is that the psychedelic field is really largely focusing on the needs of veterans and then increasingly so first responders. And while those populations are absolutely deserving of healing, there's another group that the conversation, especially the psychedelic policy conversation, has largely been silent about. And that's people who've been impacted by the criminal legal system, especially folks from historically oppressed and exploited populations, which tends to be those low-income communities of color. So the literature review is really kind of creating the case for why we even need to be talking about people directly impacted by the criminal legal system. And then the second phase of this study is where we're still in the process of raising funds to be able to conduct a qualitative study, which we're going to do in collaboration with the Center for Collective Healing, which is a decentralized research organization between Yale and Howard University. And the plan is to partner with them to do paid focus groups with formerly incarcerated people of color to hear directly from them, what stigmas there might be, what social, cultural barriers there might be, legal barriers, all to accessing psychedelic assisted healing, and then ultimately to understand what they would need to be true and in order for them to feel safe and even interested in accessing some type of psychedelic assisted healing process. So the plan is to do those focus groups and then take that information. The report that comes from that, we believe will be the first report of its kind for the field, which will be a really important uh, process for educating folks in the field who are interested in working with this population. And then the last phase, so again, so the literature review kind of gives us our why we're even talking about this population. The focus groups will start to tell us how we can begin to address the needs of this population with the assistance of psychedelics. And then the final phase of that project would then be to take information from the focus groups and then form a small working group of formerly incarcerated people, researchers, therapists, et cetera, to then actually develop a healing modality from the ground up in direct collaboration and partnership with system impacted people to then at some point in the distant future to then pilot that with that population. Yeah, so like I said, so much of the psychedelic policy field is really focusing on veterans and first responders. So even if you look at a lot of the state and local and even federal legislation that's been proposed and legislation that's been passed, a lot of that policy is really baked into is really centering the needs of, again, veterans and now increasingly so first responders. So my background is in criminal legal system reform and racial justice work. And so having spent a number of years working to fight for the rights and the needs of people who are incarcerated, especially the most vulnerable incarcerated populations from people with serious mental health issues, serious medical issues, developmental disabilities, physical disabilities, and then also doing restorative justice diversion work. And so working with communities around the country to establish healing and accountability processes that operate completely outside of the criminal legal system. I've seen a number of ways that the mental health system is either failing to reach or simply failing people who are most likely to be involved in the criminal justice system, whether via arrest, incarceration, probation, parole, et cetera. And so, understanding all of that, we really wanted to make sure that we were creating that we were creating a project that would actually begin to at least begin to address some of those underlying needs, especially since one of MAPS's core principles is healing for all. And so we really do mean healing for all. And that goes to both people who are kind of more so already vocal in this space, as well as people who typically have not traditionally had a voice in this space, or at least their voices haven't really been platformed. And so we started with that literature review, and the goal is to really, as this project grows, to continue to engaging an increasing number of people who themselves are formerly incarcerated so that there's that real meaningful representation and leadership from that population. So it's a number of things. So really a lot of this work stems from the war on drugs, stems from psychedelics being criminalized in the first place. And so when we talk about needing to, for instance, address the underlying harms of the war on drugs, there's been a movement to address that through clemency, through record clearing, expungement work. And that's really important, as well as the importance of reducing sentences, if not completely, ideally eliminating criminal involvement or the criminality or the criminalization of people who are either in possession or people who use various psychedelic substances, but then also really importantly, people who also sell those substances. And so we're hoping that by spotlighting the mental health needs and other kind of socioeconomic needs of this population, one of the political or one of the policy consequences of doing this project would then be to really bring about, kind of encourage creativity among policymakers and thinking, kind of moving away from that tough on crime knee jerk to criminalize, instead moving towards more of a public health approach where folks are really prioritizing the underlying needs of people as opposed to just kind of continuing on this decades old narrative of criminalizing folks who are involved in both not just the use of psychedelic substances, which tends to kind of, at least from my experience, the trend seems to be moving a little bit more towards public health, but while still continuing on with this narrative of calling for the criminalization of people who engage in the illicit sale of drugs. So really, we're hoping that one of the the positive things that will come out of this project is more creativity among policymakers, among advocacy groups that are pushing for policy to kind of think more broadly about how we can bring in different folks who are part of the psychedelic field, or including folks who are engaging in the illicit sale of drugs in ways that are ensuring public safety and harm reduction, but also uh, decreasing people's contact with the criminal legal system. So MAPS already has a broad network of therapists, psychiatrists, other mental health practitioners who are working with psychedelics. As you know, we already have our MDMA assisted therapy training. I think one of the things to remember is that a healing modality that works for one population may not work for all populations, especially when you're dealing with underlying trauma and especially when you're dealing with uh, groups that have historically been oppressed and exploited. So, for instance, one of the things that the literature review that we just published highlights is the failures of certain diagnostic frameworks like the ACEs, the Adverse Childhood Experience scores, and the DSM, the failures of those diagnostic frameworks to capture the impact of the psychological impact of things like structural harm, poverty, criminal legal system involvement. Those frameworks are really, really effective at pinpointing individual pathology and discrete traumatic events, but less so those broader structural harms. And so I say that because if the hope here for mental health practitioners is to really encourage them to think a little bit more critically about the approaches that they might be using for certain populations and moving away from kind of one size fits all approaches, especially when it comes to psychedelic assisted healing, and instead really encouraging folks to um, if they don't themselves have experience either working with system impacted people or they themselves are not system impacted, really encouraging them to build those relationships and do that really important critical community building with formerly incarcerated communities and other folks that have been deeply touched by the criminal legal system to hear directly from them what they need in order to then adjust their healing modalities to better meet the needs of that population. So in terms of the second phase of this project, like I said, that first one is a literature review, the second one being the qualitative studies and the paid focus groups. We're starting with formerly incarcerated people of color, and that's very deliberate because we understand that while, there are people from all different races and ethnic backgrounds who are impacted by the criminal legal system, the impact and the trauma and the harm that people of color experience is often compounded by underlying tones of racism. And so we think that it's really important to address the needs. So if you're looking at, incarcerated populations or formerly incarcerated populations, or just more broadly, system impacted populations, really centering the needs of people who kind of stand at the most intersections of all of the different vulnerabilities from racism to other kind of intergenerational trauma to different unmet mental health needs, really standing at the intersection of all those different vulnerabilities, starting by addressing their needs and exploring their needs with the understanding that oftentimes what works for the folks who are the most oppressed and exploited tends to work for everyone. So that's why we're starting with people of color.